This is Everyday Wellness, a podcast dedicated to helping you achieve your health and wellness goals and provide practical strategies that you can use in your real life. And now, here are your hosts, clinical health psychologist Dr. Kelly Donahue and nurse practitioner Cynthia Thurlow.
Good morning. We are here with Dr. Steve Horwitz. He's a graduate of Cornell and the National University of Health Sciences. He was selected by the USOC to be the sole chiropractor on the U.S. Olympic team medical staff for the 26th Olympiad. That's impressive. He has traveled internationally with USATF and consulted with several Division I sports programs. He's the chairman of the Maryland Council on Physical Fitness, the Maryland director for the NSCA, and the co-chair of the Care and Prevention of Sports Injuries program in Montgomery County, Maryland. He's a two-time champion of the Tactical Strength Challenge Masters Division and the founder of Team Safe Sports. Welcome. We're so excited to have you.
Thank you so much.
And we'd love to get started with understanding how people got to where they are today. So can you please give us a brief or not so brief history leading us up to today and how you came to do what you do?
Wow. Okay. So I guess just briefly start in college. So I was very fortunate and my parents were able to get me to Cornell University and afford that. It was a little bit of a struggle for them, but it was just an amazing experience. And with all these smarty pants, and I kind of was interested in sports and in medicine, but frankly had an injury to my shoulder and I was being shown how to weightlift for the first time, and I hurt my shoulder, and I actually had a spotter. I was smart enough at 18 to have a spotter, but the spotter wasn't smart enough to spot me, and I wasn't smart enough to make sure the spotter was spotting me. So I hurt my shoulder, and I went to the orthopedic surgeon at school, and since I wasn't an athlete, i.e. On a sports team, my exam was, does this hurt, does this hurt, does this hurt? Ouch. He put it in a position over my head that it hurt, and he said, take 2 aspirin, see you later. Literally, take 2 aspirin, see you later. And luckily, the nurse there was familiar with something called Codman's exercises, which are basic shoulder rehab exercises. This is going back a long time ago. This is 1978. So I thought, wow, isn't this interesting? That's not the way I want to be treated. I was kind of tossed out of the big shot that treats all the sports injuries and you take aspirin. I don't know if I want to do that. So it gave me significant pause to think about what I really wanted to do. And I ended up becoming a history major in school. But fast forward to one of those, I was a senior and said, I'm just still not sure. And I'm Jewish, and as nice Jewish parents will do, they look through a whole book of professional. She called a chiropractor. I'm like, well, what's a chiropractor? So I started to do some research, and I very quick Cornell University's kind of little area where you could go talk to a counselor. Those at Cornell don't go to chiropractic school. I thought, isn't that interesting? Making me want to go even more. So I started to look into it, and I thought, isn't this an interesting profession? Maybe this is the way to go. So I went to chiropractic school and got hooked up with a lot of weightlifters, interestingly enough. So you can see where this story is going with knowing a little bit about my history. And I thought, wow, I'm surrounded by these massive guys that really know how to train. And then as in school, we were starting to learn about anabolic steroids. And this is, 1984, and you'll appreciate this, both of you. The PhD in exercise physiology is telling us anabolic steroids don't enhance athletic performance. Now remember, this is 1984. And I thought, well, isn't that interesting? Because my friends at the gym, their squats just went up 100 pounds in 10 weeks. So I kind of think you're wrong, Doc. So that's where that kind of relationship between sports science, sports medicine, and the athlete was, had been apart for really by 1984, several decades with the introduction of anabolic steroids, right? By a physician from Olney, Maryland, as a matter of fact, interestingly enough. But that's a whole nother story. And
that's close to us.
There's this big disconnect. That's close to where I used to live. Yeah, maybe one small correction. I'm no longer in Maryland. I've been in Texas here for the last 6.5 years. So Maryland Council on Physical Fitness, that was way back in the day in the 90s, early 2000s. But so I started to learn there are definitely some disparities between what's in sports science, what's in medicine, and what I'm being taught with things like back school and what to do for work comp injuries with people who got hurt and lift. And once again, the professors are showing me how to lift. And I'm thinking, none of my friends who deadlift 600 pounds lift like that. I think you're wrong, Doc. So again, you can see where this blending of the training, where guys that didn't necessarily, and many of the guys I was surrounded by had no formal education. And it really made me think about how I wanted to handle myself. So fast forward, I started to compete. And then I thought, well, how am I going to handle a patient after I graduated? And that's when I decided to kind of blend the sports training with the chiropractic care, because I could never really understand, well, how could I possibly treat a patient and not understand how to train? And even beyond that, I was super fortunate to have a PhD nutrition professor. And when I started to bodybuild back in chiropractic school, he was nice enough to sit down with me and do diet diaries. Remember writing on a piece of paper, 8 ounces of orange juice, and looking as one once again is the mid 80s, way before the labeling. So I really learned a ton about nutrition because I was doing a self-diet diary. Here we have nutrition kind of outside the formal nutrition with just the N=1 Steve, and how I learned, wow, maybe it might not be a good idea to guzzle those 32 ounces of orange juice after the workout. That's all sugar. Learning that in 1984, 85, that was really helpful, frankly.
You were way ahead of the curve.
But Dr. Peyton Davis, I mean, what a sweet man. Horrible professor in front of the room, but just awesome one. I used to stand at the bulletin board and write in teeny tiny print. But he was just huggable guy, just amazing man. And he was so helpful to me. So it really made me think about how I wanted to treat a patient. So by the time I got out of school, I thought, how could I not talk about nutrition with this patient? How could I not talk about training and ergonomics back in the day of Polaroids? If folks out there remember what a Polaroid camera was, how could somebody with carpal tunnel syndrome actually go to a doctor, and how could that doctor not talk to them about what they're doing for 8 or 10 hours a day? Like, take a Polaroid of your workstation and let's take a look at it, and you see all these crazy postures. So you can see how my thought process was developed by all these different things. And that's really how I arrived at kind of my treatment styles. How could I not deal with these things? And isn't it interesting, because you see on my Twitter post how it's now all evidence, in quotations, it's now evidence. Isn't that interesting? So that's kind of how I arrived at, where I am with all the different things that I do. And I just was fortunate to have great mentors.
And I think that's really key. I mean, I am a big advocate of the concept of evolve, shift, and change, that even though I'm traditionally Western medicine trained over the course of many years in Western medicine, ER medicine and cardiology, that I got to a point where I just started saying, there has to be more to this than writing prescriptions. And so I started digging a bit deeper. And as you know, most Western medicine trained providers get little to no education on food and nutrition, other than the USDA food guide pyramid. So Kelly and I actually both did our functional nutrition program together, and completely changed our whole perspectives, especially my own. I mean, I left clinical practice to kind of go out on my own. And it always humors me when we look at studies that are from the 1970s, the 1950s, that completely dispel so much of the dogma that we were literally fed in schooling. So I think it's amazing that you were already making those connections and kind of questioning things. I think a lot of us don't spend enough time questioning dogma, and we kind of blindly follow what the masses are doing. So being an outlier so far in the past, I think is just incredible. So I think your story is what many of us, it takes us a little longer to get there, but we start to question a whole lot and, devise ways that ultimately impact our patients more. But one of the things that I've found fascinating about you is you've had this incredible journey, but you've also had a bit of a health journey yourself. So I would love for you to touch on that.
Oh boy, have I ever. So, born in Brooklyn, grew up in New Jersey, thought myself pretty tough, got into bodybuilding, powerlifting, martial arts, blah, blah. And then, oh boy, Mike Tyson comes out of nowhere, hook or undercut, and just lays me out. So right as at the end of chiropractic school, this is actually pretty interesting from a clinical perspective. I started to feel just kind of some discomfort a little bit with swallowing. Mm-hmm. And after my second bodybuilding competition, which was very successful for me. What's the standard thing? I'm eating out of a crock pot for 3 months. So I'm in Chicago at chiropractic school. So I'm going to Giordano's Pizza after the competition for the deep dish, which is delicious. And we got there and I could only eat one piece. I'm like, what the heck? Like, what is wrong here? I should be able to eat a pie. Mm-hmm. And then we fast forward several months and I'm choking on an orange peel, and thank the girl that I was seeing at the time knew the Heimlich maneuver. And she's looking at me like, no, there's something not right here. This is not normal. So luckily, my dad was a hospital administrator. He used to be the director of labor relations for the New York City Health and Hospital Corporation, is going back a long time ago. And then he was hired at a local hospital in New Jersey for the last 10 years that he worked. Anyway, so I was able to get in very quickly, and I had a barium swallow. Mm-hmm. And interestingly enough, as the barium flows down, there was some beaking, meaning looking like a bird's beak at the base of the esophagus, which is a telltale sign of something called achalasia, which is a great board question because nobody knows what the heck of it is because it's a rare disease. One in 100,000 kind of thing. But luckily, the radiologist was really sharp. Actually, it was the radiologist. I think he just told the radiologist, frankly, and he noticed it immediately. I'm really big on the techs and nurses who don't get any credit, who deserve most of the credit. That's another story, which I can talk about when I was in the hospital and all. But so that started a journey to Temple University. And again, because of my dad's connection, and to see the quote, up people. So I went to Dr. Stanley Cohen at Temple University, Dr. Esophagus. And after he took a look there, he confirmed that I had this bizarre disease called achalasia. So achalasia is an autoimmune disease. So we think, sure, it's an autoimmune disease of the esophagus where the vagus nerve doesn't function and your swallowing is disturbed. So what does that mean in regular speak? Well, your esophagus propels food and water down in muscular waves, right? So that's why in college you can, drink beer and stand on your head. But I couldn't do that anymore. So the muscular action of the esophagus fails in achalasia. So you don't have those wave pulsations. And that last third wave pulsation opens what's called your distal esophageal sphincter, which is that muscle that opens up that allows this bolus to get down into the stomach. And that doesn't work, so it stays tonically shut and kind of opens whenever it wants. So not to get too gross, you cut me off if I'm going too deep, but everything backs up and everything just sits there like sludge, and it gets pretty nasty. So I had, back in 1987, I had what's called a pneumatic dilation, where they stick a tube down, kind of like a blood pressure cuff, and they have the little pumping action, and they blow it up, hopefully not enough to tear it. So they call it stretching the esophagus. Ha ha ha, being, a musculoskeletal guy. No, you're actually tearing the fibers, and you're just praying that you don't tear them too much. That's what you're actually doing. I get it, but they're hopefully skilled at it. So I had that done. And then over the course of the next couple of decades, I just had it basically monitored. And when I moved to the Washington, D.C. area, which is where I set up my chiropractic practice after chiropractic school, I went to another top guy, Stanley Benjamin, at Georgetown. And he, quote, kept an eye on it. But he actually wasn't endoscopies, and I felt like somebody literally wrote a root in my throat for several days after he took a look. He actually wasn't really that great at it. Then in my 40s, if we fast forward, it started 38, 39, 40. I started to really have difficulty laying prone. I had to start sleeping elevated. The heartburn was really bad. It started to get ugly. And then by mid-40s, I said, really not good. By that time, I had finally gotten married at 40s, and my wife and I were like, this is no good. So I started doing research via PubMed, and everybody in the world should know pubmed.gov. We're all, you guys, everybody out there, that's the repository of all medical, medical library, National Institute of Health, medical research library, all the studies are there. And most of the time you can find the abstracts. Now there are all these websites where you can put in the DOI number, the paper for free. But anyway, that's where you can really learn. This is not a magazine or the New York Times or, God forbid, the Washington Post. No, we need to actually have the study so we can see what's really going on. I started to do some research via the National Library of Database, and found folks over at University in Seattle, and they had a swallowing institute. And I decided, after much reading and corresponding, because people should know that usually the lead author's email address is actually in a little teeny button that says author affiliations or author information. Really important things that people should know. And you can actually email the lead author of the study. And if you put together a concise explanation and description of what information you want, most of these authors are great folks, and they'll email you back. So I thought that was pretty cool. So I got a bunch of emails back and ended up at University of Washington and ended up having this surgery called a helomyotomy, which is where they do myotomy for myomuscle. They cut the muscle longitudinally, up to top to bottom, and they cut it just above and just below that esophageal sphincter, with the hope, once again, now they're actually slicing it, right, as opposed to sticking the tube down and, quote, stretching it or tearing it. Now they're slicing it, and then they do what's called a fundoplication, which is they take the top of the stomach and they rewrap the top of the stomach, not quite 360 degrees like for a hiatal hernia, but 270 degrees depending on the surgeon. I know this is going into the woods here with details, but it kind of matters because this surgeon decided not to do the fundoplication part after he saw how tortuous my esophagus was. The other part of Western medicine is this surgeon did not listen to my wife, did not listen to my brother. My brother lives out there, and that weighed very heavily in our decision-making as to where to do the surgery because, as you know, Cynthia, the recovery is key, and having a nice, comforting place to be for a while when you recover is really, really important. So since my brother lived out there, I decided on University of Washington. That was kind of the, that helped me push that decision over the edge. But this surgeon did not listen to my brother who was there, my wife, nor me. explaining to him, don't keep me completely supine, flat, raise me up a little bit, use gravity so I don't aspirate. And this guy kept me flat, and I aspirated.
Oh, no.
So I told my wife, and I'm happy to say it publicly because I won't say his name, but if ever I see him, just have the money ready because he's getting laid out.
No.
I promise. This guy didn't listen. He caused me to aspirate. It got infected. No, thank you. Even to this day, like, wow. So Western medicine, keep your ego where it needs to be and do right by the patient. And we have 2 ears and 1 mouth, right? So twice listen before you speak. Really, it's just not cool for the patient. That could have been a horrific event. Luckily, I was very healthy, so, I was able to recover quickly. Fast forward, that surgery didn't work. After 6 months, I still couldn't swallow very well. And the next couple of years went by, and then haven't really talked about this a whole lot publicly, written about it maybe a little bit, but I started to have bouts of Afib, atrial fibrillation.
It's an arrhythmia.
So the heart is not beating normally, and it's flippy-flopping all over the place. So the day before my 49th birthday, something's not right. And I didn't know what was going on because I just didn't feel good. Well, that was my first of many Afib episodes. And, hospital, get electrically cardioverted, all about that. And upon x-ray, my esophagus is enormous. Right? It's dilated almost 9 centimeters.
I wonder if that was the impetus for the Afib.
There you go. Some physical pressure on the heart, right? So now I've got confirmed, wow, I'm really messed up internally. And now I'm messing up my heart. So that sent me back again to the computer with a more updated search at PubMed, knowing how to use it a little bit better, emailing a whole bunch of docs. Now I'm thinking, oh crap, do I need an esophagectomy?
Oh my gosh.
Ectomy, removal, esophagus. Think about that. How the heck do you remove your esophagus and still live?
Yeah.
So I found a bunch of docs that do this kind of thing. And most of the time, an esophagectomy is done for esophageal cancer, as opposed to achalasia. So now you need a super duper focused expertise here, because the issues with cancer and potentially spreading the cancer, very serious, very serious, significant skill set, but different issues with achalasia, because now you have blood vessels that are dilated. So there's a huge bleeding issue that might not be as much of a problem in cancer. It's certainly not trying to minimize the cancer thing, because cancer is super complicated, but it's just a different skill set, right? There's different issues. So that led me to Dr. James Lukatich, who, the guy in Seattle could learn a lot from Dr. Lukatich about how to handle yourself with a patient. Dr. Lukatich is right on the border of confident and cocky. Exactly where I want you.
That's what you want in a surgeon.
A good surgeon quality.
Awesome guy. He's able to look you eye to eye. And he promised me and my wife, I will be in there when your husband gets wheeled in. I will be there the entire surgery, leading the entire surgery. I will be there doing the cleanup on the way out. I am not one of these, I go in, do my thing, leave surgery. That's what we wanted to hear. I also had become knowledgeable about things like intravenous vitamin C. And that was a deal breaker for me. And I said, are you willing to do that? And he looks at his assistant and he goes, I don't think that would bother anything. He goes, make it happen. So it's kind of nice to get the head cardiovascular surgeon at University of Pittsburgh's Medical Center, who's basically God there. He's the highest paid person at UPMC.
Yeah.
And he even had to fight the pharmacy. So Cynthia, you could explain to the listeners, here he is fighting the pharmacy to do IV vitamin C, and what other drugs are they giving me during this surgery? Yet he's the head of cardiovascular, cardiothoracic surgery, and he is fighting with the pharmacy to authorize IV vitamin C. Maybe you can make a comment about how absurd that is given the kind of drugs I had to do for an operation like that.
Right. I mean, from my perspective, I'm guessing that the pharmacy team didn't understand what it did and probably hadn't had to do that before. Therefore, their visceral response is to refuse. What I find interesting is that for anyone who doesn't know, cardiothoracic surgeons go through the longest residency and training program of any other physician. So when you use the term God, you're not using it, tongue in cheek. They really do spend years and years and years training. And if a cardiovascular surgeon asks for something and is getting pushback that says something, we know that vitamin C, it's a mineral, and we know that it can be, really critical in wound healing. It's an antioxidant. There's so many components to it, but the thought that you're on probably medications to monitor and control your blood pressure, you're on, medications to control bleeding. Things that have far greater impact than vitamin C. So I'm finding that humorous. I'm of course not laughing at you. I'm laughing at the situation, how frustrating that must have been for you.
Yeah, far more dangerous. And I had the IV vitamin C during the Heller myotomy. And interestingly enough, both at teaching hospitals and back in Seattle, the head resident kind of laughed and scoffed at me. But, interesting that I needed zero pain medication after the Heller myotomy, and I was up and out of there the next day, functioning quite well. And fast forward to the esophagectomy, and in the ICU, and then I'm back in the room, and I'm up walking, and I've got every tube on the planet, stuck to me, including that lovely chest tube. Which is horrible, right? It's horrible. And I'm walking around, quite drugged up, but I'm walking around, and the nurses, all the nurses see is 50-year-old man, right? Because I was 50 years old. So they just see 50-year-old man on the chart, and they're all nervous. And I'm like, I'm out of here as fast as possible. And they're just like laughing at me and whatnot. But I'm walking around every day, and I had the IV vitamin C every day. And I arranged to have acupuncture. So UPMC has an alternative or integrative health center. The problem, and I think people need to know about this, university hospital systems are starting to do this, but there's one problem with that word integrative. The center may be integrative, meaning they may have physicians with different backgrounds in acupuncture, but it's not integrated into the hospital system itself. So the head system gave me acupuncture the first time I had acupuncture, but the actual acupuncturist came in to do it the other days I was there, and he was thrilled because here he's working at the integrative center at UPMC, which is not integrated into any hospital care. And he was thrilled because it was the first time he had actually done acupuncture on a hospitalized patient in the hospital. Wow. So how integrated is it? So that was wonderful, and everybody thought I was insane. I was out of the hospital in 5 days after an esophagectomy with a pyloroplasty, by the way, where they did the Roto-Rooter. But you know what? I also trained for this. That's the other part. I trained for the surgery. I got up to the point where I was on a Concept 2 rowing ergometer, rowing 70 minutes hard. I was lifting heavy also, even though the doctor, oh my God, you have Afib, blah, 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 because I was having multiple bouts of Afib during all this stuff. Oh my gosh, blah, 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 blah. Well, I trained my butt off. So I was ready for that one hard push, like a heavy lift, and I was ready for that long, long surgery, which thank God I was ready for, because by the way, why this guy from Seattle is going to get laid out if I ever meet him is because the other thing that he did, not only did he keep me flat during the Heller myotomy, but get a load of this, Kelly and Cynthia, he left plastic clips in my esophagus. I wonder why I had more difficulty swallowing after 6 months. So isn't there like this thing called a checklist that you're supposed to kind of check when you're closing up, during surgery? Yeah, and they left plastic clips. Yeah. And so Dr. Lukatic, so after, the surgery for the esophagectomy is supposed to be about 6 hours. By hour 8, my wife is getting nervous. And after the surgery, Dr. Lukatic explained to her, He's like, yeah, this special gun that we use to kind of cut and suture at the same time, it kept getting hung up on the plastic sutures that the last guy left in your husband.
Oh my gosh.
Yeah. Isn't that nice? Oh, you're still getting laid out. But every time I talk about this. So, so I was really glad I was in great shape for the surgery. And the other part, which was lovely as a guy, was getting straight cath every day. And they didn't know what to do because I couldn't void.
Mm-hmm.
So, if you can't void, you can't get released.
Nope. You got to pee.
You got to pee, right? So guys, listen up, man. You got to pee. And I'm looking at my wife, who is, she's a former United States Secret Service agent, and she had to use those skills at my door, because that's the other thing about being in the hospital. It's like, could one person, instead of one person for every job, could you have one person do all the blood draws and all the tests at once, so you could leave me the blankety blank alone for several hours to actually get some rest?
Yes.
Right.
I understand
so
that.
She literally was at the door like, see you, chump. My husband's getting some rest. Go back and figure it out. But my husband's getting some rest. So after day 5, I couldn't void. I'm like, oh, and they're talking about surgery, right, to get me to void. I'm like, honey, I'm out of here. So I said, what's the magic cure that I say is for everything? An Epsom salt bath. So one of the things I had to do was stay for an additional 10 days, because the anastomosis, which is the juncture point where they take the new part of the esophagus, which is actually the fundus of the stomach, and joined it to the little diseased part of the esophagus. So anastomosis is just a medical term for the juncture point. They had to make sure, it wasn't going to leak. So they said, okay, you're not local. You have to stay in a hospital, literally right outside the hospital grounds for 10 days just to, make sure. Like, duh, of course, that makes sense. But the actual hospital stay, I was supposed to be in there for 10 days. And I'm like, no, I'm out of here.
I don't know about you, but I like to enjoy a nice glass of wine after a long day or with friends on the weekends. But the problem that I've encountered is that many wines have chemicals like pesticides or way too much sugar, which damages your health and sleep. Cynthia and I are both big proponents of sleep, so anything that damages our sleep is a no-go. We did some research and we found a company called Dry Farm Wine. They're the only health-focused natural wine club in the world. Their wine is all natural and additive-free, and it's lab-tested for purity, sugar-free, and low alcohol. So you can enjoy the taste of good wines without the massive chemical or sugar intake that can cause so many issues. When you join the Dry Farm Wine Club, you can choose how often you'd like to receive wines. You can choose monthly or every other month, or how many you'd like to receive. And you can choose the kind of wine you like. I prefer reds. As a special gift, if you sign up with our link, you can get a bonus bottle of pure natural wine with your first order for just 1 penny extra. That's right, 1 penny for an extra bottle of wine. Visit the link in the description to claim your bonus bottle of natural wine and join the Dry Farm Wine Club. Cheers.
So we go ahead and leave the hospital, and she's concerned also because of my insurance, right? If you leave, a problem with the insurance. So I'm out of there, and I go tub and I take an Epsom salt bath. Guess what happened?
You peed.
I was able to avoid. Why couldn't somebody tell me? Thank God I had that personal knowledge. Why couldn't somebody at the hospital tell me that? It's just very bothersome with Western medicine. Everybody out there you got to fend for yourself, unfortunately. It's a pooper. So I've seen things as a patient. So hey, so we went back that evening and told the nurse, yeah, I voided. See, yeah, I'm done. I'm back. And they're freaking out again, and then of course the next step is they want me to meet with the dietitian. And you know how we go back and forth on Twitter on that topic, right? The registered dietitian who's giving me the dietitian. I was all drugged up, and frankly, because even all drugged up, if that dietitian was a guy, I might have taken a swing. Drink milk and eat oatmeal. Like, are you kidding me? For an autoimmune disease after esophagectomy. I'm going to put regular milk into my system. Like, what planet did you get your education on? It's just so bad. So, I had surrounded myself with some really smart people prior to the surgery, things like monitor your vitamin D levels. So here's an interesting one. I got my vitamin D up to 70 before the surgery. Wow. I took 15,000 IUs of vitamin D supplement for 10 months post-surgery. And when I did the blood draw, it was at 30.
Oh my gosh.
You weren't absorbing it.
Bingo. 15,000 units religiously a day. So, it just goes, I could go on and on with how important monitoring, and that's why all my Twitter posts, one, metrics and performance, leave me alone. I'll read the science, always, but don't, at the end of the day, you got to see what your performance is, and you got to know, because everybody, oh my God, 15,000 units a day. Oh my gosh, that's so high. Well, guess what? I was still low after 10 months of supplementing like that. And there's so many ancillary stories that go with this, but then what do you do? What do you do to recover? Well, how about the musculoskeletal part of being all sliced up on the right side with the thoracotomy and all the scarring? How do you heal from that? How do you get your right shoulder range of motion back? Now, I love Dr. Lukatic. Every time I see the cattle, I want to lay him out. Anytime I want to see Dr. Lukatic, I want to give him a hug and a kiss, because he saved my life. I mean, the guy is a brilliant surgeon. Amazing, just amazing surgeon, but unfortunately not knowledgeable about recovery. So what do you do? How come patients don't get that? Now, thank God that's the area that I know. Certainly on the nutrition side, surrounded myself with super smart people. And on the training side, thank God that's my own personal skill set. So I know what to do. Thank God. And, now I'm heading close to 60. And, I just pulled a 500-pound deadlift at, 59 and, 170 pounds.
It's amazing.
I think
esophagectomy pyloroplasty.
Wow. Your journey is so incredible for so many reasons. And I know it'll be inspiring to people who are dealing with their own health journeys. One of the commonalities that I picked up on with your educational journey, which was very non-traumatic compared to your health journey, but was this attitude and this mindset of curiosity and being willing to go do your own research and investigate for yourself. And I'm wondering, when you work with the people you work with today, how do you convey that to them, and how important is that?
I can't stand patients who don't, sorry for the double negative, but I don't like it when there's no questions. Because my experience with, again, Western medicine is, the consult with one foot out the door, and to be polite, reticence, and to not be polite, I could use other words, to not answer questions. Like, why can't I have a spouse in the room? Why can't I remember adjusting a woman who was pregnant, and then she brought back her infant who was having projectile vomiting. So they put this way back when on cisapride. Drug is no longer prescribed. They put an infant on cisapride. It's unbelievable. Well, when the wife came in, the mom came in, I said, she said, my husband wants to come. I said, no, your husband has to come. Mm-hmm. I want your husband right next to us. And, when I had the little consult before I saw both of them, the husband's like, I'm really concerned. I'm like, good. I want you right next to me. Just the opposite of what I used to get told. No, I want you right there. And I want you to lay me out if I do something wrong. It's your kid. You're damn right. I want you to hit me if I do something. Like, I want you to be a passionate parent. I want you to care about your kid. I want you to question me. And I want you to be right there. 2 adjustments, the kid stops projectile vomiting. I said,
amazing. It's
not this traumatic, I'm going to twist your neck off. And man, are so many MDs going to freak out. Well, Guess what? I'm from New Jersey. I guess I can't say anymore. but you can fill in the blanks. The adjustments for the cervical spine and infant, I'm just pushing with my little finger just ever so slightly, and voila, on the thoracic spine also, and voila, that child knows it's okay to prescribe a drug, which, by the way, is no longer on the market. Woo! We got a crazy mindset. So question everything. And I love when patients, question me. Part is when they go back on the conventional side, and the conventional medicine side crushes them and says no. I just saw a video just the other day. It's a pretty cool group now. Bunch of athletic trainers who have a strength and conditioning background. And the head person was talking about, and he's clearly a power lifter, and he was training a woman in her 70s and got her deadlift up to over 200 pounds. And then she went to the MD who freaked out about it. And he was just talking about the smile 200 and how she told how confident she was, a woman in her mid 70s. I mean, how awesome in this ad. And the MD just crushed it like an ant. Sorry, that's not okay. It's perfectly safe.
So clearly, there are themes that have gone throughout your lifetime. And one of them is just being physically fit and taking care of your body. What are some of the concerns that you see as a chiropractor? What are some of the dangerous things that kind of come through your office, or people will describe, different philosophies about how they exercise? What are some of the things that are really problematic that you're seeing with some consistency? Because I think for many of our listeners, with your background
side or the...
Well, I think, you see a lot of, for example, just CrossFitting is huge right now. What are some of the things that, you're seeing in your practice that are coming out of people not using proper technique? I know that you're huge on technique. That is becoming problematic for them, either with back injuries or pain or things like that. And specific to people that are north of 40 years old, people that are middle-aged.
Right.
And yes, anyone that's in their 40s or middle-aged, you have to accept that, myself included. What are some of the things that you're seeing, the reoccurring injuries that you're seeing?
Yeah, there's lots of reoccurring injuries. One quick point I wanted to make about the chiropractor and the MD. Mm-hmm. My Olympic experience showed me